to ask some of you. Let me go to Fanina. Andrew? Andrew, are you able to speak to us? Fanina? Would you be able to speak to us? I'm asking you to unmute. Going to go to David James O'Day as well. And we do have, of course, as always, some very specific questions. Now, today's meeting is private. It is not going to be live streamed. We will upload it to YouTube later. David, James O'Day, are you able to speak? Of course, we're still 17 minutes away. So if you're busy with your duties, that is fine. Let's try Al Hassan Ibrahim, and do raise your hand if you would like to. If you are interested already in speaking, just to say hello. The same with Usman Mohammed. All right, and we are 16 minutes away. Yes, we have Fanina, Andrew, and Usman Mohammed. Please go ahead.
Hello, my name is Usman Muhammad from Hospital Services Management Board, Gombe State. Thank you for inviting me to this meeting, and I hope
warm welcome to you. I think I'm losing my voice a little bit. So this is Reda Sadki, of course, from the Geneva Learning Foundation. And we do have, actually this week, we're going to send out the invitation for the commencement event. And so that is where we'll be recognizing and awarding certification to all of you who successfully completed the first peer learning exercise focused on RCA. So how are you doing, Usman?
I'm fine, thank you.
All right. And thank you for what were you doing in your work before you joined this call?
Well, I'm just a normal routine that we used to do at Public Health Laboratory Health Complex here in Gombe. We used to diagnose measles, rubella, yellow fever samples.
Right. And we're very pleased to have you as part of the collaborative, really, to have all of the job functions, not only the vaccinators, not only the planners, but also people in the labs doing very important work. Fanina, Andrew, I believe you raised your hand. Please Hello? Go ahead and speak. Yes, please.
Hello? Hello?
Yes, please go ahead.
Good afternoon, everybody.
Hello.
All right, let's go to let's hear first from Fanina. Andrew, we can hear you, but you may be having problems with your with Fanina. Are you able to speak to us? And then we'll go to David, because David has, I believe.
Hello.
Yes, Fanina, we hear you, but I'm not sure if you can hear us.
Hello, good afternoon, sir.
All right. How are you doing today?
I'm fine, sir.
Okay, wonderful. And remind us where you work and what you do.
Okay, in Bauchi State. I'm working with Primary Healthcare Development Agency, Bauchi State.
Right. And today you are here, though,
yes.
in a personal capacity.
Yes, personal careers.
Okay, wonderful. Yeah.
Yes.
So today
is
really indeed for the government staff. So this can be local, state, or federal. And we're very proud to say that there were really an impressive number of staff who work for government who participated. And the specific consultation is for this unique set of people. As the immunization program, of course, is country owned, and this is why we're focusing on government first. We then have a second consultation right afterwards, so at 4 p.m. Nigeria time, And at that time, we'll be debriefing all organizational partners. But this one is specifically for government staff. So thank you.
Okay. Thank you very much, sir.
Looking forward to hearing from you. And you'll see that we have many, many questions for you. So if for those of you who are here early, as you know, we call you the early birds. We really want you to see. And again, we're interested in hearing the perspective of your organization. So, of course, you can speak in your own name. We understand that, because if for those of you attending in the personal capacity, you are not speaking on behalf of the organization, but we're still interested in your perspective.
Yes, sir. Thank you, sir.
All right. Look forward to hearing you later, Fanina, please. And I'm glad you joined today. Now, you can see that we'll go through the questions. So about your organization's participation in the collaborative. And for now, just think about those questions. I'm not going to ask anyone to answer them yet. But as we have, let me see, we have 12 minutes. Let me just run through them. And they are, so first of all, what level of engagement does your organization wish to have in the collaborative? Has your organization formally endorsed the collaborative? So this is, there's a lot of organizations that have expressed interest and applied, but there's actually relatively few who have actually put together an endorsement letter. So that is what that question is about. So here we want to know from your organization who participated in the RCA exercise. How did your organization support them? If there was any kind of support offered, typically that means time given to staff who participate, who are doing an RCA, work time, so that you could work on your RCA. If you've completed RCAs, if your staff were not successful in the RCA,
No, sir, my organization, they do not know anything about it. It's personal participating. So they do not participate, sir.
No, okay. Well, you participated, right?
Yes, sir.
Okay, wonderful. Yeah. So then we have another set of questions about the value of the collaborative for your organization. So what is something that you learned from the collaborative that can help your organization?
The thing that I learned that it will help my organization is that my organization, they can contribute in empowering, training their staff about immunization, so that they can know the importance, so that they can tell the women, the parents, about the importance of the immunization. So many parents, they don't know the importance of it. That's why they don't used to bring their children. But I saw of our staffs that they are in the immunization, they don't have any training, they don't undergo any training about immunization. They are just there. So I want my organization to start training them on immunization, so that they can know the importance, that can tell the women the importance of it, so that we'll have improve in our immunization.
Understood. Fanina, all right, we're 9 minutes away from starting this, really this first of a series of debriefs we'll be doing this week. I can see that there's also some people following on the Telegram channel where we're live streaming, but it's a private live stream, so it's only for people who have joined the collaborative. But today we are indeed specifically interested in one group in this first consultation, and that is really we've invited specifically those of you who said when you applied to the collaborative that you were affiliated with the Ministry of Health, with NPHCDA, or a state health, primary healthcare and development agency. So that is what we'll be focusing on today. We're very interested, of course, in understanding how the collaborative can work with government health agencies at the state and local levels. Now, this consultation right afterwards, but it's a different link. We'll be debriefing with all organizational partners. So some of you may have received both invitations. If you work for government, you may have So you may have received both of these invitations. You can choose. You do not need to attend both. The main one, the most important one, is really because the immunization program is run by and owned by the government. Then we wanted to hear from you first. So that's it. We'll be starting in 7 minutes and 40 seconds. Let's go to David James Ode, and thank you, Fanina. We'll come back to you, I'm sure, to hear more from you. David?
Good afternoon, Rada, and everybody.
Warm welcome to you. We hear you loud and clear. What's on your mind today?
All right, I am David, and then I work with a state facility, which happens to be a tertiary facility by virtue of upgrading. So I work with the internal medicine department, and then I'm a nurse by profession. Yeah, I think that's that about me for now.
Okay, wonderful. And did your facility join the collaborative, or have you been participating as an individual?
Yes, I've been acting in both capacities. Both in the capacity of my team where I present, and then as an individual who would like to contribute her own quarter to the immunization agenda.
Right, I understand. Yes. All right. Well, we're looking forward to hearing your answers to the questions. I've pasted the questions for those of you who are here early in the chat. And I'd like to ask, I think, for one more thing, which is if you would like to, for those of you who are active on social media, let me see if this whole message will paste in or not. I would be very surprised. No, okay. Let me just see.
Okay.
Let me just, I'm trying to paste something in the chat. Okay, here. Yeah. So, for those of you who are here early, I would like to ask if you could, if you are active on social media and in particular on LinkedIn, I'll show you what we're asking you to do is to go to this link, which announces this first of a series of debriefs. And I can see some of you have already done it indeed. So first to like, then comment, then repost this post. David, have you been able to go to LinkedIn and do this?
I'll do that right away. I'll do that right about now.
Okay, wonderful. Yeah. So this really helps spread the word to your colleagues so that they too can benefit from the from the collaborative.
Very well. That will work for me.
All right, wonderful. So we'll be starting, as you can see, in just 5 minutes. And it's true that our last meeting together was over a month ago. So we've missed you. We've missed members of the collaborative. We're eager to reconnect with you. As we had announced, we are working on, we finalized certification. So we'll be announcing those of you who've earned a certificate will be receiving the invitation to join the commencement event. This is where we'll be officially recognizing and awarding certification to those of you who've met the certification requirements for the first root cause analysis peer learning exercise. So we're very much looking forward to that. I will repeat this once we start at the official time, and we hope to. We're really looking forward to that moment of ceremony, which will be also quite a bit of a celebration. I'll share exactly what we have been able to do in the just in the first 3 weeks of the collaborative. Some of you may have seen the Gavi articles about the topic, so we'll certainly be looking at that together. And I believe in a few minutes there will be another article posted on the across social media, but let me see if this is the latest one. This was the 22nd of July, so no, that is. Right. Yeah. So this was from the 9th of August. For those of you who have not seen this yet, just show you what this is. And we are, let me just check on the time. We're 3 minutes away from getting started. Our purpose today will be to debrief specifically with government staff. So to hear from you really your experience of the collaborative. And we're especially interested in how the collaborative can work in your government service at the state and local levels, wherever it is that you work. And you can see here the invitation that you receive specifically if you are working for, you said you were working for the Ministry of Health. Now, what I meant to show you was this Gavi article about the root cause analysis exercise. So this was published on the 9th of August and followed really the completion of the exercise. There's some additional resources you can see here. On the 22nd of July, on the day of the launch, there's also a Gavi article here. If you have not seen these yet, I'm sharing them with you. And then there's one more, I believe. Let me just see. Whoops. That's not what I meant to do. So this is something I published on my personal blog. But yeah, what happened after just 2 weeks? There are actually 2 articles here. And this is just, if you have not seen these yet, these are really, this is what you have contributed to. This is what you have done. All right. Hello, Temitope. And if you have time, we're just 1 minute, 43 seconds from getting started. But if you have time, definitely we appreciate you. Let me just see. Yeah. Here we go. Yeah. We appreciate if you can share on LinkedIn. You can see the article here. Let me see if I can show you this. It's to go to LinkedIn and then to do 3 things: like, comment, and repost. If you want to do the things that are quickest, you first like, then repost, and then if you have time, put in a comment. That's always appreciated. So I believe it is time to get started with this consultation. Right, a warm welcome to you. We're about to get started with the first debrief with government partners, and we're specifically with government staff. Although many of you are, of course, in your personal capacity today, we're interested in your views about and your experience of the collaborative so far. So we'll be getting started in 15 seconds, and very much looking forward to coming together with you for this. For this event. Here we go. This is a private consultation, so we'll be really focusing on getting to the point and focusing on what we can learn together from this initiative. So I'll first take you through a reminder, really a refresher, because it has been over a month since we last came together. So today is the 9th of September, but remember we started on the 22nd of July. Now, we held the final General Assembly from Learning to Action on the 6th of August for the collaborative. After the root cause analysis, Learning to Action exercise that really marked the first activity of the collaborative. And today we're doing the first of a series of debriefs, and this specific debrief is for government staff. So we can see here, we're especially interested in how the collaborative can work with government health agencies at the state and local levels. We'll all be doing, after this debrief, we'll be debriefing with other organizational partners. It's a separate Zoom link, so a separate one. And then there we'll be interested in the views of all partners and really asking how can your organization get the most from its participation in the collaborative. But where we wanted to start was with the members of the collaborative who are government staff. So we're going to go to David James Ode, because our practice is to always ask for and listen to your voice first. David James Ode, a warm welcome to you. I know we were speaking before the event started, so are you there? All right. Otherwise, we'll go to Usman Mohammed. Okay. Anyway, Usman Mohammed and David Jimsode, I know that you're both here. Okay. Usman Mohammed, a warm welcome to you.
Thank you.
All right. So tell me what's on your mind. It's been over a month since we ended the first peer learning exercise of the collaborative. This invitation was sent to you because you are, when you applied to join the collaborative, you told us that you work for the Ministry of Health or for NPHCDA or a state primary healthcare and development agency. Could you tell us what's on your mind as we start this consultation, where the point is really to listen to you and to learn from your experience and how you see the future of the collaborative?
Okay, thank you very much. After the first peer learning, I actually sit down and try to engage my organization, especially the Directorate of Public Health, and then tell them about the collaborative, the how we are going to integrate it with the agency and how the agency can come in and help. They asked me actually to write a letter seeking for permission. I wrote two letters. I write the first letter and the second letter. I'm still waiting for the second reply. So on my own personal parts, I have sat with people from my own local environment, try to formulate ways how we can educate our immediate local community on the immunization actually, because I have once participated in the immunization, but during this line of peer learning pressure and the root cause analysis, I observed that still the gap we've identified is there. So personally, I begin to work on it, and we have last week Friday we have organized just a community get together where I took the opportunity to tell them about immunization, and we discussed extensively on this HPV vaccine and why people have been asking questions, and it's quite interesting, because we discussed a lot about it, and that still motivates me when I see this email. I said, okay, this is another opportunity to learn and still go and engage with the policymakers from my own agency and my community. Now that the communication barrier with my community is lifted, people are much more interested in knowing about vaccines and all these myths attached to vaccines. I've tried to talk them out of it and told them that all these vaccines have most of the side effects are mild, and it's okay when you take a vaccine and you experience these side effects.
Thanks, Usman Mohammed. Could you clarify for me? So you said that you engaged your basically your organization. You told them about the collaborative, and they asked you to write a letter. Did I understand that correctly?
Yes.
Okay.
Yes.
And so you wrote one letter. What did you say in the letter?
The first letter I was asking for their permission to get them engaged in the collaborative.
Right.
So when we finished this the peer learning, I still wrote a reminder that I'm still waiting for their response, and initially I did not go to the agency to find out if they have responded, because I have to go to the secretary to find out if there's response from the executive secretary of the agency.
Okay. And so what do you think is missing for your organization, for your hierarchy to give an answer, a positive answer, hopefully?
Well, I don't think there will be anything missing. I believe when he sat down, because the director he asked me a lot of questions regarding the collaborative. I told him what I know. They said, okay, I should attach the mail that of the first invitation for the collaborative to the second letter that I took as a reminder to them, for them to be sure that I was invited, and we did indeed. And I even sent them the letter that was sent to me. I attached to it
Okay.
So I don't think there will be any problem for them to accept.
And as you know, we did this with UNICEF and NHPCDA. So would it have been helpful to you to have a formal letter from the National Primary Healthcare Development Agency or from UNICEF in addition to what you received from the Geneva Learning Foundation? Would that have been helpful to you, or is that not something that would have made a difference in your view?
Well, that will help a lot.
Okay.
That will help a lot.
Okay. All right. Appreciate it. Okay. Well, thank you. So we're going to thank you, Usman Mohammed. We'll be hearing from many more of you. We do want to recap a little bit about what we did together during the month of July and early August. This first debrief is specifically for government staff. We're especially interested in how the collaborative can work with government health agencies at the state and local levels. The following consultation will be a debrief for organizational partners, for everyone, including government, civil society, and private sector. Now, just a quick reminder, we're going to review some of the background as we're thinking together about the future of the collaborative. And today we're interested really in debriefing to think together about what we did between the 22nd of July and the 6th of August. We are about to announce and to send out the invitation to the commencement event. So for those of you who completed the root cause analysis and met the certification requirements, you will be invited to this event to receive your certificate. This is where we'll be awarding certification. But just as a reminder, it did not matter what your job was or where you work in order to join the collaborative. What mattered is that you want to make a difference for the children and families of Nigeria. And we asked you if you faced any of these challenges, and almost all of you said you faced more than one of these. We also asked you if you worked with people in difficult to reach areas, with poor people in cities, with people affected by conflict and so on. And we said if you work with any of these groups, we especially encourage you to join. Now, you can still join the collaborative, although there is no peer learning exercises currently running or planned, but we hope to make some exciting announcements soon. What we will announce will depend in part on what you tell us today and how many people actually come to share this with us. Now, just to clarify on certification, everyone who has met the following certification requirements will be receiving their certificate. Formally, these will be awarded during the commencement event. Now, for these consultations, we have 3 consultations scheduled this week. The first one is with people from government departments and agencies, so the 3 different levels. And the second consultation that will follow this one today is with civil society and community-based organizations. And then the third will be with women leaders in the collaborative. And again, before we go any further, I already want to acknowledge the role of the ambassadors who were key to establishing the collaborative across Nigeria, an amazing network of alumni ambassadors who represent Nigerian alumni all across Nigeria because they have distinguished themselves through their participation in the Geneva Learning Foundation's programs. We also want to recognize the guides on the side. You can see the list here. And of course, working together with this first peer learning exercise, we demonstrated the potential for large-scale digital peer learning to address local challenges across Nigeria. So this is what you have done. And as before we get to the questions that we're going to ask you, just to recap the amazing achievements that you have already done through the first 3 weeks of the collaborative. Over 4,000 health professionals connected from all 36 states, more than 300 local government areas, and diverse participation. Almost 2 out of 5 participants were women. Almost 2 out of 5 were government workers, and then representation from all levels, including, you can see, LGA and facility level represent 64% of participants. Now, before we even started, you had already shared over 270 experiences in the collaborative, and these were shared in the first collection as in line with our commitment to give back what you share. We had asked you 2 questions. Can you tell us about a time when you tried a new or creative way to solve a problem to help people get vaccines? And why do you want to join the Nigeria Immunization Collaborative? And very quickly, so many experiences were shared that we issued a second volume on the 28th of July as we were finishing up in the next to final week of the first peer learning exercise. Now came the root cause analysis itself, and 410 participants submitted the draft RCA. 278 of you then submitted revised root cause analyses after participating in the peer review process, and more than 300 of you completed 3 peer reviews, and 75% of those who submitted drafts, and then 229 of you received 3 peer reviews on your work. In addition to doing the RCA, many of you participating in what we call the day 2 and 3 discovery and exploration days practiced conducting RCAs on local immunization challenges, and 60 of you volunteered to become facilitators for those sessions, practicing valuable facilitation skills. What we saw was amazing insights, and I just pulled out a couple of them. Here's the first one. Issues seem to be simple, but they are interwoven. A solution requires multiple approaches. Challenges we face in our communities are not limited to us alone. Many face similar and even more challenging issues. Root causes often have systemic issues that need to be addressed in order to be solved. Now, I learned how to do a root cause analysis. I realized that hesitancy is not the only reason for missed vaccination. Think about these insights. Did you share this insight with the colleagues who actually shared these thoughts in the feedback when we asked you for feedback? There's an ongoing engagement where we see participants continuing to share and learn even though the first peer learning exercise is over. That alone is quite remarkable. And then 628 organizations of all kinds, governments, civil society, private sector, formally applied to become members of the collaborative. To give you a sense of that diversity, you can see here a National Orientation Agency, a Primary Healthcare Development Agency, a field office of WHO, and a pre-service training institution, the Federal University of Gashua. These are amongst the organizations that not just joined, but actually submitted formal letters of endorsements. And there's now a little bit over 40 such organizations out of the 628. One of the reasons we're doing this consultation is because we really want to understand what are the barriers to go from expressing interest in joining the collaborative to actually following through with the letter of endorsement. And then you can see here the high engagement states with more than 50 health professionals participating: Kano, Niger, Bauchi, Kaduna, FCT, Sokoto, and Zamfara. Now, here are some potential ideas for follow-up. And again, I'd like to invite you to think about these, because in about a minute, I'm going to ask you a series of questions about your organization's involvement in the collaborative so far. So not you personally, having done an RCA, but what this means for your organization, recognizing that most of you are attending in a personal capacity. So some potential areas for follow-up would be to spread and scale compelling immunization ideas. If anyone, no matter who they are or where they are in Nigeria, has an idea that can help others, then the collaborative could spread and scale it. Second, no matter who you are in the system, perhaps through the collaborative we could recognize and celebrate emerging new leaders. Number 3, could incorporate digital peer learning into existing peer processes. Number 4, build on this incredible network of 4,000 plus Nigerian health professionals. Number 5, widen engagement with civil society groups, deepen that connection between civil society, private sector, and government. And then document implementation and outcomes of selected ideas from the root cause analyses. So those are some of the ideas, and we can imagine different levels of engagement and think about what this might mean for your organization. So if you work in a state primary healthcare development agency, or you work at the federal level, or you work in the local government area, you might consider 3 levels of engagement, where with low engagement in the collaborative, there you might expect the return to be modest improvements, all the way to a high level of engagement. And what we're interested in hearing is, what would those different levels of engagement mean for your organization? So not only you as an individual, but you as an organization. And which of these 3 levels might correspond best to your organization's orientation? So those are some of the things we have in mind. Now, this is how the consultation is going to work. Your insights, first of all, to be clear, this consultation is about shaping the future of the collaborative. Your insights are crucial for our direction. We value your experience and ideas. The consultation process, you'll see questions displayed on screen. Write your answer in the chat if you can. Raise your hand if you wish to speak. Make sure if you wish to speak that your headset or equipment is working, that you have good connectivity. And basically write first and speak once we call on you. And you do need to raise your hand in order to be called on. Now, your insights, what you shared today, will be shared with NPHCDA, with UNICEF and other partners. And this is going to help us align the collaborative with your needs and priorities. And again, our conviction is that together we can improve immunization outcomes in Nigeria. So here is the first set of questions. And even if you want to answer, even if we've moved down a few questions, but you want to answer the first one or the second one, that is fine. We want to hear from you. The things that seem important to you are really what we are most interested in. So the first question is this, has your organization formally endorsed the collaborative? Why or why not? There's always a why question with each of these. And what level of engagement do you believe your organization wishes to have or should have in the collaborative? So I'm going to turn to David James Ode. We had spoken before, so I know his connectivity was working. David James, are you able to speak to us and answer this first question? Otherwise, we'll go to Charles Obiora. Charles Obiora, it is... Yes, Charles, a warm welcome to you.
Thank you, Ryder. Good afternoon.
All right, please do introduce yourself. Tell us where you work and what is your role in the agency, departments, or ministry where you work.
Thank you once more for the opportunity. Good day, all. My name is Charles Obiora. I work at Alexi WMF Federal University Teaching Hospital, Abakaliki. I'm excited to be on this call today. I'm afraid I may not have a direct answer to the very first question, but I had raised my hand earlier when you were asking about inputs to the program. The program has actually been an eye-opener to what collaboration can do in the health sector, and when we are very conscious and particular about getting it right. From your foregoing statement, I'm actually looking forward with excitement to the announcements that you make about those of us that are not actually on the immunization field. Because having gone through the peer review exercise, I and some other persons that are not nurses, that are not directly involved in the immunization program, actually got to see how we can put up our skills, our time and engagement, and to volunteer with the collaboration or any other immunization exercises that we may have. Because my job as a medical laboratory scientist is not directly involved in immunization exercises, but we are very much open to partnering organizations that promote vaccinations, because we are interested in immunology, we are interested in vaccinology, and every other program that will make our young ones, children and adults, obtain to the full dose immunizations that are due to them. So basically, my facility, AIFUTA, we're actually involved in, of course, is an immunization center, but it did not officially come on this program. I came on my own as a staff. Once again, I'm glad for the experiences and kudos for the job that you guys are doing. Thank you very much for the opportunity. Thank you.
Thank you very much indeed, Charles. And we very much value the participation of, let's say, non-conventional actors in immunization and appreciate your participation. This particular debrief, though, is you were invited to because you must have put in your application that your affiliation with the Ministry of Health or with a state or local department or agency. And this is really what we want to focus on, is hearing from and learning from the folks who are tasked with, who are responsible for immunization at the state or local levels. You're welcome. You should have received, Charles, also an invitation for the for your organization to the next debrief, which is for all organizational partners. And indeed, we did see a very interesting dynamic with private sector organizations, pharmacists organizations, and others who joined whose organizations expressed interest in the collaborative. Let me go to Anifat Egunjobi. Anifat, warm welcome to you.
Yes, good afternoon. Good afternoon. Hope you are hearing me.
Loud and clear.
Yes, good afternoon. My organization, my name is Egunjobi Anifa Tomawumi from Ladoke Akitola University of Technology Teaching Hospital, Ogbomoso, in Oyo State, Nigeria. So my organization have endorsed the collaborative letters, which I've already sent to the Geneva Learning Foundation. And they are really in support. In fact, immediately they endorse the letter, they have already appointed the committee on behalf of these collaborative issues. And the committee comprises of 7 members, which we have two. We have nurses that are immunizing children and women. Then we also have one admin staff among us. So they are already they are supportive. Thank you.
Okay, that's wonderful. And Anifat, can you clarify for me, is your university a public university? So really...
yeah, he's teaching hospital.
I see.
Ladoke Akitola University is a teaching hospital attached to the university, Ladoke Akitola University, Ogbomoso. But at the same time, we still have some other things that we are doing. We are open to public people. That is, people are coming for their health issues. Then we are also for research and some other things. Then we also teach students, the medical students.
Right. And how do you work currently with the Primary Healthcare Development Agency in Oyo State?
Yes, in a PHC. You are talking about the PHC, primary health centers. We have some PHC that we are working with. Like we have some outreaches that they are under us, PHC, that under this organization. Like we are having about 6 PHC under Ladoke Akitola University of Technology Teaching Hospital.
Okay. And are there occasions when you sit down with your colleagues from government, so whose responsibility is to oversee, to organize, to plan and implement immunization activities, or is that not part of your job?
So it's not part of my job, it's management job. Likewise, the Oyo State government job. Though Oyo State government job has already, they are recruiting for the nurses and all other health workers in Oyo State.
Okay. And so do you see a way in which the collaborative, which brought together...
Hello?
So the collaborative...
Hello?
Yes, Anifat, are you able to hear me? Okay, so I'm asking if the following question. Do you think that through a mechanism like the collaborative, which brings together a pre-service university like your teaching hospital, with the state primary healthcare development agency, with other actors, do you think that this could improve, this could help coordination between government, community, private sector, and pre-service training institutions? Is that
Yes.
useful? And if so, how? Can you tell me why you would need that? Because you have not needed it in the past, right?
Yes. I don't understand that question.
Yeah. Do you think did the collaborative help you? Did you meet people from government, from the community, from the private sector that you had not met before?
Yes.
Okay, wonderful. Thank you, Anifat. All
You're
right.
welcome, sir. Yes, sir. Thank you, sir.
So I'm going to lower all the hands and just really, we want to zero in and on the individuals who are working, who are directly employed by government and who are responsible for immunization. So we selected you for this invitation, for this debrief, really specifically because you said you work for National Primary Healthcare Development Agency, a state primary healthcare development agency, or another or the Ministry of Health more generally. So if that is your case, please raise your hand so we can come to you directly. And I do see some questions. I want to address the questions in the chat. So first of all, for Ebika Kapaye Okoyen, who says, can I still have access to the RCA repository? So yes, we will be sharing the full set of RCAs, and in fact, following the commencement ceremony. So the commencement ceremony, that is when we will be awarding certification to all those of you who have successfully met these certification requirements. And after that, we'll make the repository available. We're working closely with UNICEF and NPHCDA to really understand what you have produced through these root cause analyses and how what are the best ways and opportunities to follow up on these. So thank you, Charles. Really appreciate the offer to extend the invitation to your facility. We first need to understand what's going to be most helpful, and then engage with our partners to make to determine what if we should continue with the collaborative, and if so, what we should offer in the future. So thank you, Akuome Eke, who says, I'm happy to join. Yusuf Mohamed Yakubu for introducing yourself from Federal Teaching Hospital in Katsina. It's great to see fellow educators interested here, and Mariam Musa, of course, from Murtala Mohammed Specialist Hospital in Kano. So let's all right, let's go to Temitope Pada, Tawakalit Oteba, Zainab Umar, Samuel Gia, Promise Jacob. So inviting you to speak. Temitope Ayepada, please do introduce yourself.
Okay, good afternoon, everyone.
Can you tell me which which government agency or department are you affiliated with?
Okay, I currently work in Lagos Island Maternity Hospital. Is Health Service. I work with Health Service Commission, and it's still under Ministry of Health.
Okay, and can you
Lagos State.
Can you tell me then how you are involved with immunization services in the maternity hospital?
Okay, in my department, we have the infant welfare, where we give immunization to babies, to our newborns. And so we do this from Monday to Friday. We administer different vaccines to the newborn. And also, if there is immunization, global immunization, like outreach, most of the PHCs, they come to my units, and we organize how we deploy them to the community and how the vaccines reach out to the public.
Okay, and then can you tell us what was your experience of the collaborative, and did it make a difference? Did it help you in some way with the work that you do in Lagos Maternity Hospital?
Okay, this is my first time of joining the collaborative, and from I think they've had like 2 or 3 sessions, and this is my first time, so I've not really had any encounter or there's any opportunity for me to make a move about the collaborative. But this is my first time, so I think with this peer learning, I'll take further step to.
Okay, we appreciate that.
Okay.
And did you do a root cause analysis during the collaborative in July, August?
No, I didn't join the July-August session. This is my first time of joining the collaborative.
Oh, I see. So you're a recent applicant. I see. I understand. All right. Thank you so much, Temitope Ayepada. All right. Let's now go to, Samuel Gia, Tawakalit Oteba, and Zainab Umar, as well as Rabiu Abdul Wahab. So please, Tawakalit Oteba, please introduce yourself and tell us who you are and what you do, what government service or administration you're affiliated with.
Okay, thank you so much, Mr. Reda.
Good afternoon.
All right, I think we have two of you. Rabiu, I'm going to put you on hold for a second. Let's hear from Tawakalit Oteba. Tawakalit, please go ahead.
Good afternoon. I'm Oteba Tawakalit Alaba. I work at Federal Medical Center Idiaba, Abeokuta, Ogun State. I'm a registered nurse midwife. So, and this FMC, the Federal Medical Center, is a tertiary institution situated in Ogun State.
Oh, I think we lost Tawakalit Oteba. Are you still there? Okay, so let's then go to Rabiu.
Hello?
Rabiu, over
Hello,
to you.
Reda. Mr. Reda, thank you for giving me the opportunity to speak. My name is Rabiu Abdul Wahab. I'm the State M&E Officer for State TB and Leprosy Control Program in Bakatma, which is one of the health MDS under the Ministry of Health here in Bauchi State, Nigeria.
Yep.
And since the beginning of the TGLF since last year, as of that time, I was the State M&E for Bauchi State Hospitals Management Board. And before this, in July 2024, I was deployed back to the Bakatma. So in that regard, I'm also a state supervisor for the conduct of data quality analysis assessment and integrated mentoring and supportive supervision, which is in that aspect, in that regard, we are leveraging and also supervise all the data in the health sector, especially in the secondary and primary healthcare facilities in the states, and also routine immunization is one of the key indicators that we are assessing to the quality and also to the level of service delivery and data reporting in the state. So in that regard, our collaboration with the TGLF is still intact toward strengthening the services and also ensuring the zero dose has been eliminated in the state, and also to the larger community to access routine immunization in the states. And this collaboration toward the regard to the routine cost analysis, I have done it and submitted in that regard. So thank you so much, Mr. Reda.
Thank you very much indeed. Can you tell us who else? Who were there? Did you have colleagues participate in the RCA exercise or join the collaborative from your organization?
Yes, actually, I used the leverage of the M&E working group, which is where we used to conduct bi-weekly state technical working group meeting, which is today. We will have another one by 4 p.m. in West African time. So in that regard, I used to collaborate with other my colleagues in the state and interact with them and engage them throughout the routine cost analysis.
Okay, wonderful. Thank you, Rabiu. All right. And what future do you see for the collaborative? What would you like to see the collaborative do and why?
Actually, what we would like to see the collaborative is to strengthen the collaboration, which is at the state level and also with all other health MDS in the states, and also to support the state towards strengthening the immunization and other campaign, especially in regards to the human papilloma virus vaccine that is ongoing in the state, which is when you look at the level of optimization, it needs to be strengthened, especially the level of at the community level, where the when you look at the data is very poor. So with this collaboration, we hope that we'll reach to all the eligible girls, that's between the age of 9 to 14 years. All girls in the state will access the vaccine, so that they will be protected from the papilloma virus diseases and cancer. And also in regards to the zero dose, we need to strengthen this collaboration toward eliminating the zero dose in the state. When you look at the diphtheria cases that is ongoing, is worrisome. So in that regard, it shows that at least not only the level of zero dose LGA that has been identified by the National Primary Healthcare Development Agency and Federal Ministry of Health. So we need to do a kind of survey and also assessment at the community level to identify the real causes of that zero dose, so that in the kind of diphtheria cases and other preventable diseases outbreak will not come out in the state. So thank you so much. And
So, Rabiu,
why? Because
I
it will
do have a
help
question
us
about
to
that for you.
Thank you so much.
Yeah, Rabiu, I do have a question for you about that. There are existing mechanisms for coordination, for collaboration around zero dose in Nigeria, which represents significant amounts of work. What is different for you about the collaborative that could actually be helpful, that that other initiatives, other programs, other kinds of collaboration are not doing? What's different for you? What's special for you about the collaborative, if anything?
Actually, in that regard, it's when you look at the existing structure in the state toward the zero dose, is primarily working in the State Primary Healthcare Development Board, which is need to expand the collaborative to other health MDS in the state, so that all the people that are relevant people in other health MDS to be included in the mechanism toward the eliminating the zero dose in the state. That's my thought here.
Okay. All right. Thank you. Right. Again, we are focusing in this debrief on specifically, we're specifically interested in hearing from government staff, so people who are employed by the government at state, local, or federal level. And we're specifically interested in hearing how the collaborative can work with government health agencies at the state and local levels, can actually serve the needs of the ongoing work. So for that, it is important to hear first and foremost from those who are directly involved with this ongoing work. Thank you very much indeed. Rabiu, please do raise your hand if you are from a government service and would like to share your experience of the collaborative, but also how your organization, your agency, your department, your ministry could actually bring in the collaborative, make it really part of its ongoing work. Let's go to Alima Alkamis Usman, Hashim Ibrahim Bello. Let's see, Maman Dauda, Mohammed Adamu, Patience, Human. Let's go. Let's see who is. So I'm going to ask you to unmute. Let's see, Hashim, Maman, Mohammed Adamu, Patience. We also had Samuel. Maman Dauda, please go ahead. Please tell us.
All right. Good afternoon, everyone. My name is Maman Dauda. I work with Niger State Ministry of Primary Healthcare. I was part of the August. I am the Assistant State MIE. At the same time, the State Routine Immunization SMS focal person. And at the same time, I support immunization activity. I support nutritional activities and likewise maternal and child health.
Wonderful, Maman Dauda. Yes. So tell us, what was your state ministry's primary healthcare agency's participation in the collaborative?
Well, it is great, because as I am talking to you now, we have two health ministries. We have a Ministry for Tertiary and Healthcare Services, and likewise my own ministry, which is a Ministry for Primary and Healthcare. And from this, we are also collaborating in different aspects because we are carrying each other along in terms of healthcare services and needs to ensure we have a good and quality healthcare delivery.
Okay, and so for in terms of your work, how do you work on immunization in your day-to-day job?
Well, for me, I do spot checks, and I also ensure that data issues that I have seen from the dashboards are corrected. Although I have access to national platform, which is the DHIS, and likewise SMS platform, where I monitor. For DHIS, I monitor all the indicators across the healthcare services. Then for SMS platform, I monitor routine immunization.
Maman Dauda, I think we've lost you. I can no longer hear you. I hope you come back. We had some more questions for you. Maman Dauda, are you able to? Let me see if I can. Let's try to get, but I think he lost his connection, unfortunately. Okay. All right. Let's keep going then. Maman Dauda, if you can manage to come back, please do let us know. Raise your hand. But I think, unfortunately, and again, in this consultation, so we have another link. I'll be sharing the link in the final few minutes. We may have had a technical problem with the link this time. We're not sure. We're going to figure that out after this. But we're really the purpose, the focus here. Okay, here is Maman Dauda. Okay. Are you
All right.
Okay, wonderful. Yes, my first question for you was to ask exactly how you're involved with routine immunization. Is it specifically on the data quality and data management?
Yes, the first one is also data management.
Yep.
And likewise monitoring and evaluation, because having informed the house that I work with primary healthcare agency, I am also from Department of PRS,
Okay.
which is also planning, research, and statistics, and under immunization, under M&E unit. So aside data management, I also do monitoring and evaluation. Most of assignment given to me is to track and monitor all the facilities in the state within my units.
Okay. And could you tell us, so from the state level, when are you next working with LGAs and facilities on revising microplans? What's the cycle for that? Is that right now? Is that happening right now, or is that scheduled for later in the year?
Yes, we have done our microplanning. We have just finished the month of August. We had training on microplanning with all the key soldiers of the LGA, where we have invited all the key managers of the LGAs. We have trained them to ensure that we have a good and quality microplan developed. We have done that training in the state, at the state level, and we have also cascaded that training at the LGA level, where all the facility staffs were trained for development of microplanning.
Okay.
And as I'm speaking to you, I last week we had collaboration with CHI, because CHI was to support the state on spot check on few facilities in the state, where we went in with our checklist to check in Penta 1, Penta 3 coverages, and also issues around data use at the facility. And likewise, we also checked on Rota 3 and the new vaccines introduced, which is HPV, to see if they are being reported and if they are being used in both fixed sections and outreach sections. So aside that, we also do mentoring in the facilities where we mentor the facility staffs at the end of the day after the spot checks. We did that to the facility staffs that are available or the child. So we just finished that one on Friday last week.
Okay. And so now if the microplanning is done for the year, can you imagine fitting the root cause analysis method into the next planning cycle, asking staff and helping them get up to speed to do a root cause analysis before they revise their microplans?
Yes, we did that because even when we are done, we were during the August root cause analysis. I have to feedback. I gave feedback to my organization, and we also find time during the state level training of the microplan, and we explain to them, and we discuss about root cause analysis, ensuring that when the LGA team are doing the cascade training at the LGA level, it should also be introduced, and that was done, and which we believe that the feedback we got from the micro planning from the facility and LGAs was better than the previous ones we have been doing. So it shows that there was a level of understanding and level of improvement using the root cause analysis with major problems we have around the facilities and also the LGA.
All right, wonderful. Thank you very much indeed, Maman Dauda. Over now to Amos Orieri. Now we have only 12 minutes left, okay, so
that's fine. I was trying to add that this root cause analysis, it was my first time to join such kind of a thing, and it was a very, very beautiful thing because it has impacted a lot of knowledge to what I have had before, and I have been implementing what I have learned from you guys, which has also given me another big opportunity to at least excel to an area of my specialization. And I must confess that you guys are doing a very wonderful job, and it's good to be associated with you. Thank you.
Thank you very much indeed. The feeling's mutual. Today's consultation will be asking you about the individual benefits. Here we're really interested in exploring what's the benefit for your organization. So, but both are important, both matter. Now, it looks like we've lost Amos. Let me see if there are... yeah, we lost him, unfortunately. Okay, and we're almost out of time. We do have a mechanism through which you can then share your more extensive feedback in writing. And Mohamed Adamu, please go ahead. I see you have your hand raised and microphone open.
Yeah, thank you. Good afternoon. My name is Mohamed Adamu. I am a nurse by profession and working with Federal Teaching Hospital Gombe in the Infection Prevention and Control Unit, and as well I'm the program manager of an organization called Rural Health Mission Nigeria. Considering my work as an infection prevention nurse, I have been working in Federal Teaching Hospital Gombe for over 10 years, and I work together with the immunization unit, because as an infection prevention control unit, we work collaboratively with them. And under my organization, Rural Health Mission Nigeria, I've been working with the State Ministry of Health in Gombe and State Primary Healthcare Development Agency in Gombe, in Yobe, Taraba, and Plateau State. So I've been working for over 10 years.
Okay. Very interesting. So I'm just thinking aloud, but initially we had in mind consultation with government staff who are tasked with carrying out immunization activities or planning immunization activities and coordinating them. What I've heard so far in this consultation is a number of individuals who work in pre-service training institutions in particular. So I'm wondering if maybe we should do a specific consultation to explore how, for example, you might teach in your curriculum, you might teach root cause analysis as part of pre-service training. But that is an aside. Mohamed Adamu, Yeah, please go ahead. How can the collaborative help improve coordination between government, community, private sector, pre-service, education, training? What are your thoughts on that?
Yeah, my thought on this is actually because considering that this collaborative have brought almost all the stakeholders on deck, from the tertiary, the state, and the primary care level, and as well as the specialty organization. It will help in bringing them together in terms of empowering the community, so that the community can participate as far as immunization is concerned. Because what I learned from this collaborative, initially I was thinking the major causes of immunization missed or the zero dose is actually a vaccine hesitancy, but I've come to realize that there are a lot of causes leading to the zero doses. I believe with the collaborative effort, bringing all the stakeholders on together, it will improve a kind of good understanding between the stakeholders and down to the community level.
Okay.
And it can also help in building the capacity of the healthcare workers that are directly involved in the immunization program. Great,
thank you, Mohamed Adamu. We're going to end. We're already at the 52-minute mark. We're going to end at 45, but we need to hear from Becky Tagbo, who and Becky, you'll be our last speaker in this consultation. Everyone will be then receiving a link by which you can submit your written comments. So if you were not able to speak today, do not despair. Becky, what are your final thoughts?
Thank you, Reda. Thank you, everyone. Happy to be here again. The last exercise was really enriching and exciting. And one good news I have is that for my organization, actually, I'm a professor of pediatrics and I'm a clinician, but I also work at, that's at the University of Nigeria Teaching Hospital, which is a federal institution under the Federal Ministry of Health. But we have an Institute of Child Health under that teaching hospital that takes care of child welfare activities and clinics. So it's a kind of primary care service. So immunization is inclusive. And I kind of supervise and oversee the staff. So I have a lot of leverage, to bring to bear what we do at TGLF. So I succeeded in getting many of them to enroll for the last exercise, including the director of the institute herself. So at our last meeting, I was supposed to be there so I can really find out how much they participated and then to bring down my blueprints on how we can move forward. But there was a hitch somewhere and I couldn't attend that meeting. So maybe next meeting, I'll be able to, bring together or find out who attended, what they learned, and then how we can move forward.
Okay.
Thank you very much.
Thank you, Becky. And we'll be reaching out to organizational partners because we have that information. Of course, we can tell you who from your organization participated and successfully completed. So we're going to follow up with all of the organizations that expressed interest, applied to become a member of the collaborative as organizations. All right, we're at the 55-minute mark. I see. All right. I see. Yes, there are other people still waiting to speak. Unfortunately, we're going to have to end here, but I'm going to give you the link to join the consultation that was intended to be for non-governmental organizations. But I think given the how this one has turned out, let me just go see, make sure I give you the correct link. So really a debrief and a strategy session for partner organizations. So I'll be as soon as we close this This Zoom room, I'll be opening up the one for the consultation for the debrief and strategy session for all partner organizations. So again, today we haven't been debriefing individuals. We know you have a lot to say about your individual experience in the collaborative and the root cause analysis exercise, but because we had over 600 organizations join the collaborative, including government health agencies at the state and local levels, we wanted to have this consultation first. Once again, thank you, and perhaps we'll see some of you in the next consultation as well.